Can you drive with a slap tear of your shoulder? I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of the book, That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on sports and exercise injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. Slap tears or superior labral tears of the shoulder can be very, very painful. The question is, what effect does that have on your driving? Let's talk about it in today's Ask Dr. Geier video. So the labrum is the cartilage bumper along the socket, and a slap tear is a tear of the top of it where your biceps tendon attaches. Can be a source of pain deep in the shoulder, can be really, really uncomfortable. And a lot of those superior labral tears don't heal on their own. So especially in younger people, we talk about surgery to either trim those out, sort of cut out the torn part, or often to reattach them with stitches and anchors. Now, if you have a labral tear but aren't having surgery or trying to avoid surgery, yeah, you can absolutely drive. Obviously, you have to be able to control the car, so you can't be in so much pain that you can't do it. But if you're able to drive, there's no real reason you can't. The question gets to, if you have surgery for a superior labral tear, then at least in the first 3 or 4 weeks, you probably can't drive. I know people drive one-handed all the time, but legally that's not safe. You know, you need to be able to get both hands on the wheel and swerve the car suddenly if you have to for whatever reason. You know, a car coming up, the wrong way or whatever. You need to be able to use both arms. And if one of them is in a sling, obviously you can't do that. And it's just not safe for you or for other people on the road. So I'm not going to give you legal advice about that. But most doctors don't approve of their patients driving within the first 3 or 4 weeks after surgery. Talk to your doctor and get specific medical advice from him. But then you just basically have to be able to get your motion back and your strength back, so that you can move your arm and use it normally. So once people are out of the sling and I feel like they're strong enough to do it, I usually tell my patients, get into a big store parking lot or maybe in your neighborhood early in the morning and test it out and see how your arm feels. Make sure you're able to control the car, and if you can, then maybe you start driving fully at that point. Okay, have you suffered a slap tear or superior labral tear of the shoulder, had surgery for it? How did it go? Were you able to drive? What other restrictions were you given by your doctor? I'd love to hear your experience. So in the comments below, share your experience. I can't answer specific medical questions there because I'm not your doctor, but I would love to hear your experience. And honestly, I think people watching this video from all around the world would love to learn from you as well. Now, do you like videos like this? If you do, I record several of these videos every single week on sports injuries and injury treatments and injury prevention. So subscribe to my video channel. Click the subscribe button in the upper right corner of the page. Those videos will get delivered directly to you. Thank you so much for watching. I really hope this was helpful, and I look forward to seeing you right here next time.